Hi there, students, and welcome to Crazy Nurse RN channel. I'm Crystal Merdocanes, nurse educator, teaching fundamentals of nursing practice. If you have any question or if you want to clarify some gray areas with regard to our topic today, please comment down below. I'll be glad to read your comments and answer your questions. Also, if you want to suggest any topic or content for our next videos, please write them below. And if you find this YouTube channel useful, please click the subscribe button and hit the notification bell to keep you updated for new video uploads. And please do not forget to check the description below for additional inputs and some clarifications with regard to this lecture video. So our topic today is about spirituality. So what is spirituality? It is generally thought to refer to the human tendency to seek meaning and purpose in life, inner peace and acceptance, forgiveness and harmony, hope, beauty, and so forth. Okay, so it is more of a personal and subjective experience of a person. So what is religion? So usually applied to ritualistic practices and organized belief. So examples are Christianity, Islam, Hinduism, Buddhism, and so forth. Okay, so that is your religion. How about what is your agnostic? What is agnostic? So it is a person who doubts the existence of God or a supreme being, or believes that the existence of God has not been proven. Okay, so these are people uh, who are doubtful of the existence of a supreme being. Okay, we also have your atheist. What is atheist? It is one without belief in a deity. Okay, deity means a god, creator, and supreme being. So they do not believe in God. Okay, that is your atheist. What is spiritual care? Also known as your spiritual nursing care. So it is an intuitive, interpersonal, altruistic, and integrative expression that is contingent on the nurse's awareness of the transcendent dimension of life, but that reflects the client's reality. So this means nurses gives spiritual care to patients who have spiritual needs or concerns, okay, by way of spiritual interventions, okay, spiritual nursing interventions. Okay, we also have here spiritual distress. What is spiritual distress? So it refers to a disturbance in the belief or value system that provides strength, hope, and meaning to life. Okay, so obviously this means that it gives our patient an uncomfortable feeling or behavior with regards to his or her spiritual aspect. Okay, so it's mainly a disturbance. Okay, it gives him or her uneasiness with regards to his or her spiritual aspect. Spiritual health, also known as spiritual wellness or well-being, often portrayed as the opposite of your spiritual distress, results when individuals intentionally seek to strengthen their spiritual muscle, as it were, through various spiritual discipline. Okay, so it's more of a wellness spiritually. Okay, health, spiritual health, wellness, or well-being of a person. What is spiritual or religious coping? It refers to the spiritual beliefs or ways of thinking that help people cope with their challenges. Okay, so that is your spiritual or religious coping. Okay, it's a way of thinking or a way of believing something spiritually that help a particular person cope with the struggles or challenges of life. So we have here guidelines in giving spiritual nursing care. First is to seek a basic understanding of clients' spiritual needs, resources, and preferences. So this reflects the assessment phase of your nursing process. So you have to know first what are the spiritual concerns of your patient. Then you look for the spiritual resources that would help your patient. For example, prayers, spiritual materials or religious materials, or someone who could help the patient recover spiritually. And also you have to know his or her preferences. Okay, you have to know the religious belief of that patient. Okay, before you give spiritual intervention or spiritual care to that patient. Follow the client's expressed wishes regarding spiritual care. So we have to respect the client's wishes in terms of giving spiritual care. Do not prescribe or urge clients to adopt certain spiritual beliefs or practices, and do not pressure them to relinquish such beliefs or practices. So you let the clients practice his or her own spiritual beliefs. Okay, you are there to support and facilitate his or her spiritual needs. Strive to understand personal spirituality and how it influences caregiving. And lastly, provide spiritual care in a way that it is consistent with personal belief. Okay? So overall, you have to respect the religious practices of your patient in terms of giving spiritual care to them. Okay? So what is holy days? It is a solemn religious observances and feast days throughout the year. So includes fasting or special foods, reflection, rituals, and prayers. So nurses, you should know those religious practices, and you have to observe and respect those holy days that your patient has. Okay? So what is sacred text? People often gain strength and hope from reading religious writings when they are ill or in crisis. So each religion has sacred and authoritative scriptures that provide guidance for its adherents' beliefs and behaviors. For example, for Roman Catholics, we have your Bible. So, for example, if a Roman Catholic patient is hospitalized or is admitted in the hospital, so you have to provide a Bible for him to read, because that gives him the strength and hope despite the disease or the illness he is experiencing. Okay, so we have to be mindful and we should know those sacred texts of our patients, okay, to help them spiritually. Sacred symbols, so include jewelry, medals, amulets, icons, totems, or body ornaments, or your tattoos that carry religious or spiritual significance. Worn to pronounce one's faith, to remind the practitioner of the faith, to provide spiritual protection, or to be a source of comfort and strength. So these are your sacred symbols. Okay? So each religion has its own sacred symbols. And as a nurse, you should familiarize those sacred symbols to help your patient cope with the illness or the disease that he is experiencing. Prayer and meditation. So what is prayer? So involves humans pleading or experiencing the divine. It is an inner experience of gaining awareness of self. So we have four types of prayer experience. First, we have your ritual. It is a memorized prayers. So that means it is repeated. Okay? We also have your petitionary, means requesting something. Okay? Requesting something from a supreme being or from God. Colloquial, conversational prayers. Okay? And lastly, we have your meditational or the moments of silence. Okay? We also have your meditation. Okay? It is the act of focusing one's thoughts or engaging in self-reflection or contemplation. Okay? So your meditation is more of an inner encounter of oneself. Okay? It's more of a reflection and contemplation. Okay? So these are the differences between your prayer and your meditation. So now we have here beliefs affecting the diet of your patient. So healthcare providers prescribe diet plans with an awareness of the client's dietary and fasting beliefs. So it's very important that when prescribing diet plans, we have to consider the religious beliefs or fasting beliefs of our patient. So beliefs about illness and healing. So some people or some clients may ascribe disease to the inner presence of sin and evil in this world, whereas others may believe the disease is a punishment for sin in their past. Okay? Also, we have belief about dress and modesty. Some religions require, some religions, okay, require that women dressed in a conservative manner, which may include wearing sleeves and modestly cut tops and skirts that cover the knees. Okay, so there are some religions that are really conservative in terms of their clothing. Okay, so as a nurse, we have to know and respect those practices. Okay, we also have beliefs related to birth. So many religions have specific ritual ceremonies that consecrate the new child to God. For example, in Roman Catholic beliefs, okay, uh, they practice baptism, okay, the baptismal rites. So this is where a new child or a newborn child is being baptized in a church, okay, administered by a priest. Okay, so that's a another practice, okay, of a religion. Okay, when it comes to birth. Beliefs related to death. So many believe that the person who dies transcends his life for a better place or state of being. Some religions have special rituals surrounding dying and death that must be observed by the faithful. Okay, so some religion believe that reincarnation happens after death. Okay, so we do not argue with that. We have to respect their belief. Okay, whatever beliefs you have, you just have to respect your patient's belief. Also, when it comes to a death experience, okay, or dying experience of your patient, we have to also let them perform their own rituals. Okay, we are there to facilitate what they need during the time, and let them do their let them do their rituals. It's a way of respecting the religious beliefs and practices. We also have presencing. So it is a term describing the art of being present or just being with a client during an existential moment, a gift of self given by a nurse who maintains an attitude of attentiveness towards the clients. So by just being there to your patient during the during the most during the most trying times, okay, you need to be there to support and give him the encouragement amidst the disease or the illness that he is facing. So we have here how to increase spiritual awareness. So first, these methods or these guidelines of increasing the spiritual awareness of a nurse is is related to those who are taking care of dying patients. Okay, so here are some of the guidelines. First is we have to write an self epitaph. Okay, what is that? It sums up in a couple of lines what is significant about your life or how you would like to be remembered. Okay, so that is your epitaph. And also, the definition of your epitaph is a short statement about a deceased person, often carved on his or her tombstone. Okay, it can be poetic, sometimes written by poets. Okay, so that is your self epitaph. Then after that, you explore personal end of life issues. Imagine having a terminal diagnosis. What feelings would you have? What would be your priorities for the time and energy you had left? Okay. Then you need to create a personal lost history. Answer questions such as these. What was your first experience of death? What was the most recent or difficult death in your life? How did you cope? What is your coping style at times like these? How did you feel your grief? Okay. Next, we have the list. Next, you have to list significant values. So you write down what possessions, individuals, activities, roles, personal attributes, and so forth you prized most. Then, after that, you conduct a spiritual self-assessment. Consider what gives you strength and hope. What makes you joyful or despairing? How do you explain or relate to suffering? What is your sense of purpose or mission in life? And what nurtures your spirit? Okay, so these are the 5 ways on how to increase nurses' spiritual awareness. Okay, so also these are the following strategies for nurses who wish to increase their spiritual awareness so that it can impact client care positively for those who are dying. Okay, for those who are dying. So I believe this is the end of my discussion. So thank you so much. I hope you learned something today.